Welcome back to Health Talk. You know, you can see this and you can tell your friends to see this on the World Wide Web, www.tvchannel19.com. Again, I'm Dr. Kenneth Levine. I practice in Tamarack, Fort Lauderdale, and I look forward to meeting you. Anyway, I'm back here with one of my favorite buddies, Dr. Michael Raymer. You know, Michael, in our practice, I believe in the team approach to dentistry. You have the abilities to do things that I can't do. Patients come to me and they say, can't you do my caps, my crowns, my dentures? I say to them, the last time I did dentures, caps, and crowns was almost 40 years ago. You don't want me to do that. You want dentists, restorative dentists like yourself, to do the beautiful teeth. How do you work with that, Michael?
Well, Ken, I will tell you that you get to do things that I also can't do, so it works well for both of us. One of the things that I think really is beneficial for our patients when we work together is I really think that you and I have a very similar philosophy, that we try to be very comprehensive in our thinking. We really try to look at the overall presentation of the patient, look at all the factors that can affect not only their teeth, their gums, but all the possible solutions that we can offer to help them. And I think that with you and I both having a very similar approach in that fashion, we really can do very, very predictable dentistry for our patients and make them happy on both ends of the dental care.
You know, in today's world, many patients are driven by economics, and there are cheaper, I'll call it cheaper options for them to pursue. And we face that every day where patients say, can't you do this or that, because my previous dentist said he can do it for less money and he doesn't have to do all the things. I think all of our patients deserve to have the optimal dentistry, the ideal dentistry presented to them. There are times when we can't do optimal or ideal, and we need to compromise because of medical reasons, sometimes because of financial reasons. But I know in our practice we have financial options for our patients, even allowing them to pay for their care up to 7 years. So we try not to make finances an obstacle to care. How do you feel?
Very similar as to you. Some of the finance options that have become available to dentists over the years really have taken treatment plans that maybe before were unaffordable to patients and have made those options now affordable. And I always tell my patients that if we're able to take something that seems like it's too costly for you right now, and we're able to spread it over the course of time and allow you to do the dental care now that you need, I think those particular financial options for patients are a wonderful thing. They allow a lot of people to have dental care that they weren't able to have done before, and I think it's a tremendous benefit to patients to have those available.
We have options now. I think we work with 3 finance companies, and patients can pay for their treatment up to 7 years with no prepayment penalties. So if they come into a bunch of money, they can save money relative to interest payments, and it really makes the finest dentistry possible available to most people.
I agree. It's very difficult to see that people have that as a limitation. You know, traditionally, things that have kept patients from really coming to the dentist have been things like fear, and of course, dentistry, especially when there's comprehensive work that needs to be done, can be an investment for patients, but I honestly think that the best investment they really can make is doing the right dentistry, the proper dentistry, and the comprehensive dentistry at the time they need it. But when patients kind of allow themselves to be treated in a little more of a patchwork style and not a comprehensive style, I think in the long run it really costs them more, it's more aggravating, predictable, and I think if it's the old expression, you know, kind of do a job big or small, do it right or not at all. And if they do it right up front, I think they're making a great investment that really protects their future.
You know, what I say to my patients, I tell them that they're going to be making a big investment for their health. I tell them that no matter what dollars they give me, I'm going to give them more in service value than they give me in dollars. I've never had a patient in the past almost 40 years say to me, gee, you know, it wasn't worth the investment. Usually they say to me, I should have done it sooner. I'm sure you find similar things going on.
Absolutely. You know, listen, being the son of a dentist, like I said, I've been around dentistry my entire life. I take my responsibility as a healthcare provider very seriously. One of my mentors who trained me to become a prosthodontist from the University of Maryland actually said to me in his closing words before I graduated, told me that no matter what the personal cost, no matter what the time, to do the best work I can do on every single patient, and that's always kind of been my personal practice philosophy.
Michael, thank you. We'll be back to Health Talk with Dr. Kenneth Levine in just a few minutes. Thank you.
Smiling is infectious, yes it's true. Please be careful or you'll catch it like the flu. You haven't smiled at me today when I was blue.